You could easily forget that in many respects, England is still in lockdown. But the rules that are still in place are still hugely limiting. Social distancing, many shops still shut, and who knows when our pubs will open again. To really end the lockdown, it's contact tracing that the government is now pinning their hopes on.
If we don't collectively make this work, then the only way forward is to keep the lockdown. Put better, the more people follow the instructions, the safer we will be, and the faster we can safely lift the lockdown.
Central to this policy working, and therefore central to ending the lockdown now, is that people will actually follow the instructions given to them. In some cases that means isolating for up to 14 days, even if you don't have symptoms. That's a pretty hard ask at the best of times, but after the fury of Dominic Cummings' actions, the big question is, will people do what they're told?
The NHS COVID-19 app...
First, let's recap what contact tracing actually is. There's been lots of talk about a new app. Well, forget that for now. There's still no date for when it will go live across the country. Instead, what the government is launching at 9 AM tomorrow is much more low-tech. Here's how the contact tracing will work. If a person tests positive, a contact tracer will identify anyone they've been in close contact with. Those contacts will then be classed as either low or high risk. Contact tracers will then get in touch with people who might be at risk. They might be asked to isolate or get tested themselves if they start getting symptoms. Each of the 4 nations are doing this slightly differently. In Scotland, they're also starting their contact tracing system tomorrow. Northern Ireland has already got that system in place, and in Wales it will be rolled out on Monday. So how hard are these instructions? How much teeth do they have? It was something that Boris Johnson was asked about today.
But is it compulsory or is it advisory?
We intend to make it absolutely clear to people that they must stay at home. But let me be clear, Matt will be...
What do you mean by must? Is it a law or is it advice?
We will be asking people to stay at home.
Health Secretary Matt Hancock further clarified the position later.
This will be voluntary at first, because we trust everyone to do the right thing. But we can quickly make it mandatory if that's what it takes.
So what is the evidence so far that this has had any effect on public attitudes? Well, a Snap survey for the Daily Mail found that 65% of those polled will be less likely to follow the rules. But considering isolation will be crucial to ending this lockdown, the hope is people will look past Mr. Cummings' actions. That's what the Director of Public Health in Chester believes.
From where I can talk on locally in Cheshire, it's been a fantastic response, and people are obviously following the guidance, which is really, really important to do. I think what you tend to find is when we explain to people the importance and what we've all had to go through the last few months, we don't want to repeat that. So when we can talk those things through, make sure people got the right support if they need it to be able to self-isolate, I'm confident, and we've seen a great support, that will continue to happen.
The government's messaging on lockdown had been praised for its clarity and effectiveness, and with a few exceptions, most people in the UK followed it. The government now has its fingers firmly crossed that the Cummings saga hasn't, as some of its own backbenchers fear, muddied that message to the detriment of our health and our freedoms.